Bethesda, as we always honor Older Americans Month, Bethesda has chosen, we will have speakers each Friday, and we are so pleased this particular Friday, the first Friday of the month, in Older Americans Month. We are so pleased to have our special speaker today. And first of all, I want to give honor to, I don't know if she's on here, Miss Adrienne Jones with Gen Care, who coordinated our speaker today, the event today. And we know it's not easy for a speaker to take time, a doctor to take time out of our busy schedule to be with us. So we do really appreciate that. And we want to give her as much time as possible. So I want to welcome, I'm going to call her Dr. EJ, and I'm going to let her pronounce her name. I don't want to mess it up, okay? But her specialty, the doctor with us today is with Gen Care, and her specialty is primary care. Dr. EJ is board certified in internal medicine. She earned her bachelor's degree from Xavier University in New Orleans, Louisiana, and her doctorate at the New York University School of Medicine in New York, New York. She completed her internal medicine residency at the Emory University School of Medicine, in Atlanta, Georgia. Dr. EJ is a member of the American College of Physicians, the National Medical Association, and the American Board of Internal Medicine. She says, my goal is to listen to my patients' needs and wants so that together we can achieve their health goals. I look forward to building lasting relationships with new patients. And Dr. EJ, I will say this at this time too, when you go, as you speak, you can tell us about the practice that you work with and what they specialize in. Dr. EJ considers herself to be a, quote, foodie. She enjoys trying new foods, often whether through cooking new recipes or trying new restaurants. She also likes traveling and experiencing different cultures and traditions. On a trip to Costa Rica and Panama, she had fun eating the local foods and participating in adventurous activities, including zip lining and surfacing. So she's not one who sits on the sidelines. All right, so I want to welcome you, Dr. EJ, to our platform today. And our pastor has joined us to support us. So we really appreciate your being here. And at this time, I'm going to turn it over to you. At the last 5 minutes, I'll give you a signal to let you know that it's, the time is up. All right, thank you, Dr. EJ.
Yes, can you all hear me?
Yes, we can.
Okay, great. Well, yes, as you stated, I go by Dr. EJ for short, but my full name is Dr. Ijeoma Ejigiri, but I know for some people that's a mouthful, so that's why I just go by Dr. EJ. And you are correct. Currently, I am at Gen Care Senior Medical Center, and as our name implies, Senior Medical Center, we serve seniors. Geriatrics is our specialty. We pride ourselves in providing VIP care for our seniors. So if anybody is looking for a new doctor or just interested in checking out what we're about, please reach out at the end of the presentation. I have all our contact information, where we're located. So I invite anyone, if you enjoy the talk, if you're interested, to please check us out. But for today, our discussion we're going to be focusing on is heart health. As you said, this is Older Americans Month, and heart health is a big issue for our older Americans. So I have a little presentation that we're going to go through. So I'm going to share my screen so that you all can see the presentation. I understand some people are just on the phone, so if anybody is not able to see the presentation, I'll be explaining what we're seeing on the slides. So, as I said, we're talking about heart health today. So what we're going to talk about is what exactly is heart disease, what are the targets that you need to focus on for your blood pressure and cholesterol to prevent yourself from having heart disease, what can you do to help keep yourself healthy, and what are the warning signs of heart attack and stroke. So that's what we'll be focusing on today. So to get us started, I actually want it to be a little interactive. So I'm going to be asking you guys, the group, I'm going to be asking you guys questions. I would like people to participate, respond to the questions. Those of you who are on the computer, feel free to type in the chat, but also welcome to come off mute. Those are people that are on the phone. Come off mute and just let me know what you think, okay? So we're going to get started. So it's true, false questions that I want to ask just to see what people are thinking. So first question, true or false? High blood pressure can often be a silent disease, and you may have no signs, no symptoms, no problems that you're having high blood pressure. Is that true or false?
True.
True. True.
True. Yep, I'm hearing lots of true. Somebody typed in the chat, true. Yes, so you guys are starting out great. You are absolutely right. High blood pressure, we call it the silent killer. Why? Because of the fact that you can be feeling great. You can be feeling absolutely wonderful and can have extremely high blood pressure. So this is one of the things we're going to talk about today. What can you do to keep your blood pressure under control and when to seek out help? Because you guys are absolutely correct. You can be feeling great and having very high blood pressure. Next question, true or false? Even if your cholesterol is high, you can feel fine. What do people say there? Even if your cholesterol is high, you can feel fine. Is that true or false?
True. True. True.
True. True, yep, true. Lots of trues in the chat. Again, you guys are knocking it out of the park. That is another one. Just like high blood pressure, your cholesterol could be very high, putting you at risk for a heart attack, and you might just feel great. You might think, I don't need to go to the doctor. I don't need to go get checked because I feel fine. But don't let you just feeling fine tell yourself that you don't need to get checked. All right, you guys are doing wonderful. True or false? I should have my cholesterol checked every year after the age of 40. True or false?
True.
What do people say?
True.
True.
True. True.
True. Yep, exactly. You guys are amazing. And yeah, more people writing true in the chat. So you guys are really on top of it. You're absolutely correct. For the reasons that we just talked about, everybody should have their cholesterol checked every year after the age of 40 because of the very fact that you could be feeling great and have no idea. Excellent. Next question, true or false? People who are not overweight don't have to worry about high cholesterol.
False. False.
False. False. Yep, getting some false in the chat. Again, I can't get anything past you guys. You are absolutely right. That's a misconception that a lot of people have. They think, oh, you know, my weight is not too bad. I don't need to worry because my weight is not bad. No, that's not true. Even if your weight is not bad, but you're not eating right, you're not exercising, your cholesterol very well could be high. So absolutely, like we talked about, need to go to your doctor and you need to get checked. All right. Next question. Since the nutrition label on my favorite food says there's no cholesterol in here, I can be sure it's a heart-healthy choice. True or false?
False.
False.
False. Yep, exactly. Let me see what we put in the chat. False. Exactly. You guys are on top of it. That's another one that you have to be careful of when you're shopping in the store. Food will be labeled as low cholesterol or it'll be labeled as organic. Just keep in mind, even if something is labeled as organic, labeled as low cholesterol, what about the sugar? What about the salt? those things can affect you too, can affect your heart and your blood pressure as well. So just because it says low cholesterol or just says organic, that is not enough for you to know that it's a healthy choice for you. You got to look at the sodium, that's the salt content, and also look at the sugar. Sugar has a big impact on our health too. So definitely you guys are on top of it. Next one. True or false? I must avoid the foods that I really like to keep my cholesterol in range. True or false?
False.
False.
False. Right. Exactly. That's another great one. Let me see what people put in the chat. False. False. I'm not getting anything past you guys. You're absolutely correct. When I'm talking to my patients and I'm counseling them about high blood pressure and high cholesterol, I don't tell people that you have to avoid everything that you love. We're all human. We all have foods that we enjoy. We all have our guilty pleasures. What I tell my patients is everything in moderation. You know, it's your birthday. You want to have cake? Of course, have cake on your birthday. You're celebrating your grandson. Enjoy it. But it just can't be every day you're eating foods that you know are unhealthy. But everything in moderation. That's what I tell my patients. Okay. Next question. Heart disease runs in my family, so there's nothing I can do to prevent it. True or false?
False.
False.
False. Yep. Let's see what we got in the chat. False. Guys, doing amazing. You're absolutely right. I hear that from my patients a lot of times too. They say, oh, well, you know, my mom, she had all these health problems, so I know it's going to affect me too. No, we don't have to accept that. If you are willing to make changes in your own life, you don't have to have the same problems that your parents did or your family members did. Definitely, a lot of this is in your control. Great. Next question. True or false? As long as I take my diabetes medication, diabetes will not affect my heart. True or false?
False.
False. Okay, what else do people say? Anybody else? Okay, somebody else wrote false in the chat. Does everybody agree? I didn't hear as many responses. Does everybody agree? Is that correct? As long as I take my diabetes medicine, I don't have to worry about diabetes affecting my heart. Does everybody agree that's false?
No.
Oh, okay. Now everybody's not in agreement.
Yeah.
Okay. Somebody said true. Okay, so we're having some mixed responses here. Some people say false. A few people say true. Well, here's the one with this question. It's false. So those who said false were correct.
Uh-oh.
So here's the thing. Yeah, uh-oh. Right. So here's the thing with diabetes. Of course, this is very extremely important that you take your diabetes medication, and that will help keep your sugars under control. But diabetes affects so many different things in the body, and diabetes can absolutely affect your heart. And people with diabetes are actually at increased risk for heart attack. So because of that, we recommend diabetes patients, they take their diabetes medicine, but sometimes we'll also prescribe them medicine to protect their heart. If you have diabetes, or if you have family members who have diabetes, you may hear, or you yourself may have been prescribed a medicine for cholesterol to help keep cholesterol under control and decrease risk of heart attack because of the fact that diabetes can affect the heart. So that one is a little bit tricky. That was kind of like my little trick question And a lot of you are already on top of that, but just want to make it clear that diabetes can affect so many different things in the body, and diabetes can definitely affect the heart and put people at risk for heart attack. So for diabetic patients, we usually give them diabetes medicine and medicine for the heart. So thank you to those guys that were still on top of it. So as I said, really the purpose of this talk is to talk about heart health, and the biggest thing that's going to affect the heart is blood pressure and cholesterol. So this is a picture of what a healthy heart looks like. And as you can see on the heart, you have all these different blood vessels that go through the heart. And what happens when you have a heart attack is that you have a lot of cholesterol building up in the walls, in the blood vessel of the heart. And if there's too much cholesterol buildup, you can get a blockage. And when you have a blockage, the blood doesn't flow like it should. And that's when you're at risk of having a heart attack and no longer having healthy heart. So that's why we're talking about cholesterol. This is what we're talking about with the diabetic patients, that they're at risk for building up increased cholesterol in their heart. So that's why we try and treat our diabetics and get the cholesterol under control. The other big part that's very, very, very important is blood pressure. So we're going to talk about that next. But when we talk about heart disease, it really just refers to a group of conditions that can affect the heart and cause chest pain, heart attack, cause the heart to all of a sudden stop beating. All those things go together with heart disease. But one of the most important things we can do to keep your heart healthy is keep your blood pressure under control. So when we talk about blood pressure, what do we really mean when we say blood pressure? Well, this refers to how much pressure that the blood that's pumping through your body, how much pressure that your heart has to pump against each time it beats. That's what we talk about when we say blood pressure. So if your blood pressure is high, that means your heart has to pump really, really hard because there's so much pressure it has to pump against. So we don't want your heart to have to work so hard. That's why we want to keep blood pressure down rather than up. So what is a good blood pressure? So you may have heard the number 120/80. That's what we consider a good blood pressure. You know, there's a top number and the bottom number. The top number, that's the systolic. The bottom number, that's the diastolic. And when we say systolic, that's the amount of pressure that your heart has to pump against while it's squeezing. When we say diastolic, our bottom number, that's the amount of pressure in between the beats. But you don't have to remember all of that. Just remember 120/80. That's what we consider an excellent blood pressure. That's the magic number to keep in mind, 120/80. So going from there, what if you're just a little bit above that? If you're just a little bit above that, we call that pre-hypertension. When you start getting into 140/150, that's when you're classified as having high blood pressure. On the bottom, when you're going up above 90, that's what we call high blood pressure. But remember the normal, 120/80. You remember nothing else from this talk, remember 120/80. The other big part of heart health is cholesterol, like we just talked about, how it can build up in those walls of the blood vessels. So what is cholesterol? When we say cholesterol, what is it? It's a waxy, fat-like substance that's found in the cells throughout your body. So cholesterol can be good and it can be bad. Cholesterol, like I said, is found in all the cells of your body. You need it to function, but that's the good cholesterol that you need to function. What we want to focus on is preventing the bad cholesterol from building up. And like we talked about, your cholesterol could be high and you may not even know. So the way to really, yeah.
I'm sorry to disrupt you, but we're asking the host to mute everyone because of the background noises. It's interfering with people hearing you. Okay, thank you.
Sure, sure.
Sister
And
Winfrey,
I'll try and
I'm sorry, it's on the hostess, I'm sorry, it's on Dr. EJ's end. I think she's in her office. That's where the noise is coming
The
from.
children, are the
Oh,
children in your
Yeah,
background?
so she's
sorry.
fine. You're fine. Just go
All
ahead
right.
on with your
I'm
presentation.
sorry. All right, thank you.
I'm sorry, and I'll try and speak a little louder. I'm sorry for the background noise.
All right, no problem.
But as I was saying, you can be feeling great, you can be feeling fine, and your cholesterol could be very high. So the only way to really know for sure what your cholesterol is to go to your doctor and let them run a lab test to tell you exactly what your cholesterol is. So as we talked about, there's the good cholesterol and the bad cholesterol. The easy way to remember it, LDL, that's the bad cholesterol. So when you see that L, think of lousy. HDL, that's the good cholesterol. So when you see that H, think healthy. That's the easy way to remember it. And this just refers to the different types of cholesterol. So remember, LDL is bad. We don't want that number to be high. HDL, that's the good cholesterol. We want that number to go up. So remember that not all cholesterol is bad. So when we talk about heart disease, there are certain things that you will be able to control, and there will be certain things that you won't be able to control. So as you get up there in age, you're going to be at increased risk for heart disease. And unfortunately, there's nothing we can do about our age, right? It is what it is. Another important one is ethnicity. Unfortunately, we see that in African Americans, in our people, it's very common that we're at increased risk for heart disease. Again, there's nothing you can do about that, right? We're born how we're born. But in the next slide, I'm going to talk about the things that we can control. But just keep that in mind, that African Americans are at increased risk for heart disease. Gender. Actually, men are at increased risk for heart disease. Again, there's nothing you can do about that, but just keep that in mind. Where if you're a man yourself, your loved ones, encourage them to get themselves checked, because being a man in and of itself, that's a risk factor for heart disease. And then lastly, family history. If it runs in your family, your mother, your father, they had heart disease, heart attacks, that's going to put you at increased risk, and there's nothing you can do about that. But just keep that in mind, that these factors will put you at increased risk for heart disease. But let's focus on what can we control. So if you're a man, there's nothing you can do about it. You're African American, that's what we were born with. You can't control that. But what is in our control? So probably the biggest, most important thing is diet. What you choose to put in your mouth, what you choose to eat. You have 100% control over that. The amount that you consume, even if you're not the one doing the grocery shopping, you may not have the most options, but the amount of food, the portions that you consume, you have control over that. Another big one is beverages. So a lot of times people focus on the foods that they're eating, but they don't think about what they're drinking and how that might contribute to heart disease and how that might contribute to your blood pressure and your cholesterol. So remember, drinking soda, drinking juice, the amount of alcohol that you drink, all of that is still calories, and all of that can still affect your heart. So don't just focus on what you're eating. Keep in mind about what you're drinking. Along with that, your salt intake, whether you choose to add salt to your food. Another big one people tell me about, I don't add a lot of salt to my food. I use sea salt. Keep in mind, even sea salt, it's healthier, but at the end of the day, it's still salt. Another big one, hot sauce. My patients tell me all the time, I don't add salt to my food, but I just put some hot sauce on there to make it taste good. You know what's in hot sauce? Salt. So just keep that in mind. You might be making healthy choices and eating good, but if you're dousing it in hot sauce, then you're still adding salt to your food. Physical activity, the amount of physical activity that you do, that can absolutely help your heart And that's in your control too. So if you just spend all day at home, you're just sitting all day, of course, that's going to put you at increased risk for heart disease. And, you know, it doesn't have to be that I don't expect anyone on here to be running marathons, to swimming laps in the pool, just small things. Even throughout the day, you just get up and stretch your legs, go to the mailbox. That's better than nothing. That's better than just sitting. And that's what I tell my patients who are worried about high blood pressure, who have heart problems, that I don't expect you to be running or going for miles, but just want you to start somewhere. Some type of movement is better than nothing. Another big one that people don't realize is stress. Stress can absolutely affect your blood pressure, and if you're under stress for long periods of time, eventually it can affect your heart. So working on trying to manage stress, that's very important for your heart health as well. And then smoking, that's another big one. People realize, of course, that smoking can affect your lungs and affect your breathing. But remember that smoking will absolutely affect your heart and can affect your blood pressure. So when I have patients that tell me I don't want to take a lot of medicine, I don't believe in taking medicine, then we go through this list and we talk about, are they doing the different things on this list? And a lot of times I have patients that tell me, oh, I still smoke here and there, or, you know, I just smoke half a pack a day. Well, that's a huge one that you can work on right there to help decrease your risk of heart disease. And then lastly, medication. So if I have patients that have high blood pressure, high cholesterol, like I said, we try and go through everything on this list. You're still making through all these changes on this list, and you're still having trouble with your blood pressure and your cholesterol, that's when we have to think about the medications to try and get things under control. So when I spoke about diet, let's just go a little bit deeper. When we talk about diet, I don't like to make it complicated. I like to make it simple. And an easy rule of thumb that you can go by to help you know that you're eating healthy is when you're making your plate, try and fill up half your plate with fruits and vegetables. Keep the meat to just 1/4 of the plate, and then your grains, so your rice, or if you're eating spaghetti, keep that to 1/4. But I know this is easier said than done, because a lot of times when I'm eating, typically if I'm eating spaghetti, I'm going to fill up the whole plate with spaghetti. Or if I'm eating rice, I'm tempted to fill up the whole plate with rice. But this is something to keep in mind. Just a very simple way you can help make sure that you're eating healthy is to try and break that habit of filling up the whole plate with rice, filling up the whole plate with the spaghetti. Try and just keep the spaghetti and the rice to one portion. If you're having greens, don't just have the greens in one little quarter. Try and have the greens fill up your whole plate. If you're having salad, don't just have the salad in one little quarter. Have the salad take up this whole half of the plate. And right there, you're already doing yourself a big service. And you didn't have to think real hard and study real hard and do a bunch of research to know if you were eating healthy. Just that one simple rule will help you there. And then water. Like I said, the beverages. Keep in mind the beverages. Drinking soda, drinking juice, alcohol, all of that right there is empty calories. You try and prioritize making water your main drink of choice, already you've made a healthy choice there. Again, you didn't have to remember a lot of details. You didn't have to do a bunch of research. Just remember water. Try and make things simple for my patients. Make it easy, achievable goals. So just saying I'm going to start with getting water rather than getting juice at dinner time, boom, you've already made a healthy change right there. Like I said, with the drinks, you have to remember that there's a lot of calories there in drinks, and that alcohol, drinking too much of it over time can absolutely affect your heart. So this is an example when we say having a drink, what is considered a standard drink. So having one beer, having a glass of wine, That's considered a standard drink. And really for women, we recommend no more than 2 drinks a day. And for men, no more than 3 drinks a day. Hopefully you're drinking even less than this, but if you want to know what is really the most that you should be having, these are the ranges. 2 drinks per day for women, 3 drinks per day for men. And like I said, there's quite a bit of calories in alcohol. People don't realize that. So this is just to put it in perspective. Having a large glass of wine, you're having the same amount of calories as you would having this ice cream dessert. So remember that. A lot of people don't remember that you're getting a lot of calories with drinking alcohol. Look at this. Having 2 bottles of beer is the same amount of calories as having a steak. So just keep that in mind. A lot of empty calories here, and that is absolutely not going to be good for heart health. So just keep that in mind with the beverages. Sometimes that sneaks up on people. And then, of course, we talked about smoking. We know that absolutely this can affect your heart, your lungs, put you at risk for emphysema, lung cancer. But remember that it absolutely affects your heart too. So if you are a smoker, or if you have family members who are smoking, remind them. They might think, oh, my breathing is good, the smoking's not really affecting me, but it is affecting your heart. Then we talked about stress management. What are simple things you can do to help with stress management? I'm not saying get rid of stress, right? That's not realistic. In the day and age that we're living in, we all have stress in our lives, and there's no way that stress is going to go away. But how you respond to stress, how you manage it, that is up to you. So little things, just taking time throughout the day to meditate, taking time throughout the day to pray. That's probably one of the best and easiest, it's a free thing you can do to help control stress. Exercise, moving. Even if you can't move very far, time in nature, just being in the sun. Being in the sun is absolutely good for you. Another cheap, easy way to help with stress. And then, of course, sleep. And in these current times that we're living in the pandemic, being socially connected is really good for stress relief. So the pandemic is starting to get better, but COVID is still out there. So maybe you don't want to go and be out that much. I commend everybody for joining this call. Just doing things like this, us spending this time together this morning, that's still a social connection and is good for you. So I encourage everybody, even if you're not physically getting out there because you're concerned about COVID, do as many virtual events like this so that you still have that social connection. Lastly, I want to finish with what are the warning signs and symptoms of a heart attack. So we talked about all the things you can do to prevent it, but even still, you can be at risk for these things, especially in our age group, amongst seniors. So what are the signs and symptoms to look out for, to know when you need to immediately seek out help? Of course, we're going to say chest pain. We know that that's a given. Chest pain is not something you should ignore. If you have chest pain that's not going away, don't just say, oh, I'm just going to go lay down. If you have chest pain every day and you say, oh, I'll just work through it. No, go get checked. Speak to your doctor. If you don't have a doctor, call GenCare. We'll get you set up. But of course, that's number one, chest pain. But it's not always chest pain. As you can see here, sometimes it comes on as abdominal pain, nausea, vomiting. You feel like you're about to faint. Throughout the day, you constantly feel weak, feel like you're about to faint. You're constantly sweating. You have cold, clammy skin, all these different things. The point is, when something doesn't feel right, don't just blow it off. Go and get checked because you never know when it can be heart disease. And also say, especially amongst women, a lot of times with women, we don't have the classic symptoms of chest pain. Not necessarily, women might not always say, I'm feeling pain in the middle of my chest. It can be a lot of these different other symptoms over here. So definitely recommend, if something is not feeling right, it's not going away, don't just sit on it. See your doctor. Like I said, if you don't have a doctor at GenCare, we're definitely accepting new patients. So really, like I said, any of those symptoms on that list, they're not getting better, seek help right away. And one of the things that you can do if you are concerned about a heart attack is to actually take an aspirin while you're waiting for help. You guys may have heard different things about aspirin in the news, but in an emergency situation where you're having chest pain, absolutely advise, go on ahead and take an aspirin while you're waiting for help. So that brings us to the end of my talk. So I'm going to open up the floor for questions. But as you can see here, I've listed the address for where we work, GenCare Senior Medical Center. I'm going to put our number in the chat. So if you're interested, please encourage people to reach out to us. Come take a tour, come see what we're about. But like I said, these are the type of things that I talk to my patients about. I like to work with my patients, see where you're at, what you're interested in. I go through that list that I showed you guys of different things we can do rather than just reaching for medication. But if all those different measures don't work, then we do medication. But the goal is to keep our patients happy and healthy. I will stop there. The floor is definitely open for questions.
Dr. EJ, would you read the address and give the phone number out loud, please?
Oh, sure. Yes. For those who cannot see, the address is 2124 Candler Road. That's C as in Charlie, A as in Apple, N as in Nancy, D as in David, L as in Larry, E as in Edward, R as in Robert. 2124 Candler Road, Decatur, Georgia, 30032. Our office number is 404-836-0272. Again, that's 404-836-0272. And I'll type that in the chat